All right, hello everyone. My name's John. I'm a student physical therapist working with Dr. Pratt. Today we're going to do a demonstration of electrical stimulation. In this specific case, we're going to do a high volt TENS. This is for pain modulation mostly. Our patient today is a 36-year-old female who 4 months ago had a baby and 2 months ago was lifting the baby out of the crib and pulled a muscle in the low back and has been having some pain ever since. So the main reasons we would want to use electrical stimulation are to prevent atrophy if they've had a period of not being able to move around or anything like that. It can also reduce or prevent edema or swelling. It is good for muscle contraction and muscle strengthening, but as I mentioned earlier, the main reason that we're going to use it today is for pain modulation. Our patient is at about a 6 out of 10 after completing physical therapy today, so is making some progress, but still pretty uncomfortable right now. Some contraindications or reasons we wouldn't want to use electrical stimulation include if the patient has an implanted device like a pacemaker, if they have a seizure disorder like epilepsy, if they are pregnant and have a history of miscarriages, you would want to avoid this. If they're pregnant, you would want to avoid putting electrical stimulation around the abdominal area or the pelvis. Also, if they have any type of cardiac arrhythmia, we wouldn't want to do this just to keep the patient safe. And some other common ones are if they have an active deep vein thrombosis or any active cancers. So before we get started, hi, my name's John. How is your knee feeling now?
My knee's good.
Or your back, I'm sorry, your back.
No, you're good. It's still a little painful, but...
It's a little sore?
Yeah.
Okay. So I want to use what's called electrical stimulation. It's really good for helping with pain, but before we do it, I want to make sure that we're safe to use this on you.
Okay.
Do you have any deep vein thromboses?
Nope.
Do you have any active cancers?
Nope.
Do you have any seizure disorders like epilepsy?
Nope.
Okay. And then do you have any implanted devices like a pacemaker or anything like that? Okay. So as I stated earlier, patient is currently not pregnant. So I think we would be a good candidate to use this on you today for the low back like I said, this will really help with your pain. So are you okay with doing that?
Yes.
Okay, perfect. So I will have you flip over. I'm gonna move this big old red bolster. I'm gonna stick this under where your hips will be.
Okay.
And then I'll have you lay prone on your belly for me. So something important when doing electrical stimulation, if you're in an area that is a little more personal, the low back isn't bad, but just to make sure that the patient feels safe, I'm going to use a couple towels to kind of drape. I'm only going to expose the area of the low back that we need to expose, and then I'll cover it back up with a shirt or the towel just to make sure that the patient feels covered up. So I will have you go ahead and pull your shirt up a little bit. Okay, perfect. And then I'm just going to place these towels on you, but before I do, I just want you to point to the spot on your right side where you're feeling the pain the most. Right around there. Okay. So I'm going to put this in and tuck it just under your belt, and then another towel just to keep you covered up as much as we can. Okay. So I already have the channels plugged into the leads here. Since it's mostly on one side, I'm just going to go above and below it. And since we're using a biphasic high rate pulse current, we can use just the one channel. So I'm going to go ahead and put these on. These can be a little bit cold, so sorry about that. And then before you do it, I just saw the patient scratching the back. You want to check the skin for any type of like rash or blistering or anything like that, just to make sure. It's pretty rare, but this can have an effect on the skin, so you want to check before and after just to make sure that the patient didn't have any type of adverse reaction. Okay, so it looks pretty good. Have you had any recent hemorrhage or infection in this area?
No.
Okay, perfect. So we'll go ahead and set this up here.
Oh, that's cold.
Sorry, it's a little cold. Okay. fold this over just to keep you covered up. And now we're gonna demonstrate how to do this on the machine. Okay, so as I stated, we're gonna do a biphasic current. Typically you wanna do this for about 20 minutes, so I'm gonna go ahead and ramp up that time. And then I'm gonna push this button here to change the rate. So the pulse rate, that's 50 pulses per second. That's actually pretty good, but the pulse duration is a little high, so I'm gonna lower this a bit. I'm gonna get it to about 100, so it might take a second. Okay, so usually it'll stop about partway through and then you can get it the rest of the way. So the ramp up time is really just the very beginning when the patient will feel that. I want to do a 10 to 30, so it'll be on 10 seconds and then off for about 30, and then it'll keep doing the buzzing sensation that we want. So then coming back over here, I'll push the start button. Okay, so as we do this, it should feel pretty nice. It shouldn't cause any sort of contraction or muscle twitching or anything like that. If it does, let me know. We need to adjust the machine a little bit. Okay. But again, just pay attention to it. It should be pretty relaxing, okay?
Okay.
So we are doing this in a setting where it's gonna cause gate control pain theory. So it'll help a lot while we're doing the treatment and then for a little bit afterwards as well. So I will go ahead and start ramping up the intensity, and you tell me when you start to feel like a comfortable buzz, but again, no twitching, no muscle contraction, okay?
Okay. I'm feeling the tingling right now.
Okay, so we'll go ahead and start, and we'll kind of let that run for a minute. And again, just make sure it's not painful or anything like that, okay?
Okay.
So I decided to use bigger pads. Sometimes this can be a little uncomfortable if you have the smaller ones, and there are other currents that are a little bit more comfortable, but this is gonna work better for this specific situation. And again, it's all about patient comfort and helping the patient to recover as well. Okay, so after about 20 minutes, the treatment is gonna be over. So if the machine hasn't turned off, just go ahead and turn it off, keep them safe, make sure they don't get a shock or anything like that, which doesn't really happen, but again, just keeping patients safe. Okay, so how does your back feel now?
It feels good.
Okay, great. All right, so I'm gonna cut off the machine here. I'm gonna lift up the towel, we'll take the pads off. I'm gonna check your skin just to make sure there was no sort of reaction, and then we'll be good to go, okay?
Okay.
All right. Okay, so the skin looks good. I don't see any redness or any type of blistering or anything. So I think we had a good successful treatment with it today. And now I will let you sit up, get ready, and that'll be it for your treatment today. Okay, so that is electrical stim.